to 86% on February 20. And currently, the recovery rate has increased to almost 90%. This increase in recovery was accompanied by a decrease in the bed occupancy rate of the National COVID-19 Referral Hospital for the last 10 days from 38.79% to 28.2%. And regardless of the good news, we are continuing our efforts to improve our preparedness towards the transitions and adaptation period by increasing the number of beds that has reached more than 94,000 per March 7, 2022. On the other hand, the number of active cases is still relatively high, even though it decreased by 97,000 in the last week after experiencing an increase for the previous 8 weeks. Data on March 7, 2022 still recorded the number of active cases of 448,273 cases. Thus, all efforts to handle COVID-19 must continue to be carried out consistently, even though cases at the national level has shown a decline. Although the increase of mortality rate is relatively lower when compared to the increase of positive cases, the government is committed in preventing any increase of mortality rate in the country. Unfortunately, when positive cases began to decline, the weekly death trends continued to increase. As of February 21st to 27th, there were 1,708 deaths, which increased this week to 2,099 deaths. This means that there is still an increase of 300 deaths compared to the previous week. In an effort to adapt to handling COVID-19 in Indonesia, the government believes that the prevention of deaths due to COVID must be prioritized. Reflecting on the cases development, reducing mortality rate remains to be one of the main priorities in the process of adapting to the COVID-19 pandemic. In the period from January 21st to March 6th, of the 8,230 patients who died in hospitals, 51% had comorbidities, and 56% were elderly, and 70% had not been fully vaccinated. This means that it is very important to protect the elderly and vulnerable groups by monitoring health protocols and increasing full dose vaccination coverage. For this reason, also considering the reductions of the vaccine effectiveness due to the existence of new variants, the best guarantee of herd immunity can be achieved by vaccinating as many people as possible, even up to more than 70% of the population. Unfortunately, based on government vaccine data processed by World In Data site as of March 6, 2022, only 53.5% of the population has been vaccinated with a full dose. Meanwhile, the number of the people who have been vaccinated with dose 1 has reached 69.48%, or almost 70% of the population. We should be grateful that in the midst of limited vaccine stocks and access in the world, we have exceeded the world's first dose achievement and are almost overtaking the complete vaccine dose. Therefore, we must make the best use of access to vaccines and continue to increase our vaccinations efforts, especially ensuring that the public receive complete doses of vaccines as well as boosters. The immunity of the community that is formed after vaccination must also be continuously monitored with regular sero surveys. Remember, herd immunity will safeguard community productivity in the midst of this adaptation period. Next, I will explain the latest development regarding the national COVID-19 layered policy in the context of adaptations toward a safer and more productive society during a pandemic. Even though the government has taken down and eased up a few traveling policies, the national leveling policy is still in place in order to keep the COVID-19 cases on a down low. The most recent update related to this policy is the issuance of the instructions of the Minister of Home Affairs, number 15 of 2022 last week. And this leveling policy keeps health protocols in place and will be able to alert us if there is a spike in cases. In addition, in accordance with the President's direction and a joint ministerial decisions, there will be numbers of adjustment in the policy. And regarding the health protocol for international travelers, or we call it PPLN, as stated in the Task Force Circular number 12 of 2022, the updates are as follows. First, the implementations of mandatory health monitoring for 1 times 24 hours for international travelers who have been vaccinated with the second or third dose. The obligation to retest COVID-19 continues to apply, both for entry tests at the arrival gates and on the third day independently after completing the health monitoring obligations. And second, 7 times 24 hours quarantine for international travelers who have only received the first dose of vaccines and those who cannot be vaccinated due to special health conditions or comorbid diseases. The obligations for COVID-19 retest still applies to this category, including entry tests at the arrival gate and exit tests on the 6th day of quarantine, both of which will be carried out centrally. Third, quarantine or health monitoring, both independently or centralized, will no longer regulate that there will be similar requirements for domestic travel documents for all mode of transportations and to all regions in Indonesia. And these requirements will include first, negative COVID-19 tests will no longer be compulsory for domestic travelers who have been vaccinated with the second or third dose, proven by vaccine certificate. And second, it is required to show negative COVID-19 results, either in the form of negative antigen test results taken within 1 times 24 hours, or negative RT-PCR test result taken within 3 times 24 before departure for domestic travelers who have not just received the first dose of vaccination, and for domestic travelers who, due to special health conditions or certain comorbid diseases, cannot be vaccinated. Please note that domestic travelers who cannot be vaccinated due to certain health conditions must show doctor's notifications acquired from the local government hospitals in addition to the travel document requirements. And this update is effective as of March 8, 2022. And regarding health protocols for international tourism and official activities in Batam, Bintan, and Bali regions, as stated in the Task Force Circular number 13 of 2022, updates are as follows. The first, both independent as well as centralized quarantine and health monitoring obligations will be eliminated for foreign travelers who will be entering Indonesia territory through entry points in Batam, Bintan, and Bali. And specific for international travelers who are not domiciled in Batam, Bintan, and Bali will require to show hotel booking confirmation and payment for tour packages. Indonesia citizens who travel from abroad is excluded from this obligation, but must be able to show their national ID cards or kitas. And especially for Bali area, travelers must show booking confirmation and payment for a tour package that is valid for a minimum of 4 days stay. In addition, the entrances for the Batam and Bintan areas are Hang Nadim International Airport and Batam Port for international travelers, for those who wish to travel to Batam area, or Raja Haji Fisabilillah Airport, Bintan Port, and Tanjung Pinang Port for international travelers who wish to travel to Bintan area. And second, the obligation for retesting is still carried out for international travelers to Batam, Bintan, and Bali in the form of RT-PCR testing on the 3rd day after arrival. In addition, the obligation to carry out of COVID-19 tests is no longer valid before entering any place within the bubble area or exit test to complete the journey. And third, the implementations of the international scale official activities in Bali, Batam, and Bintan refers to the bubble system health protocols that has been implemented in the G20 meeting series of activities in Indonesia according to the Task Force Circular number 6 of 2022. And this update is effective as of March 8, 2022. And regarding the health protocols for MotoGP in Mandalika and stated in the Task Force Circular number 14 of 2022, updates are as follows. First, the testing obligations prior to departure and entry test for spectators based on country of arrival. And domestic travelers are not required to do testing if they have received second and third dose of vaccination. Meanwhile, international travelers, spectators, are still required to submit a negative RT-PCR results taken within 2 times 24 hours before departure from their home country and must carry out an entry test of RT-PCR. And if found positive, international travelers is obliged to isolate in accordance to the applicable procedures. And second, spectators who wish to enter the venue must have received the second and third dose of vaccination, and testing obligation prior to entering the venue and or during the event will no longer be applicable. And this update is effective as of March 8, 2022. And learning from the handling of previous pandemic cases that have been experienced by the world and Indonesia, the condition of COVID-19 is influenced by policies, community behavior, and the characteristics of the virus itself. With the dynamics of the three, the best way that can be done is to reduce the number of vulnerable populations and control the potential for transmission in the community. On the other hand, given the uncertainty of the conditions in this case, Indonesia must continue its recovery efforts in other sectors such as education, economy, tourism, and others. And according to the findings from the World Bank in 2021, shock to the economic sector in various countries were contributed by policies to limit community activities and people's behavior. Both are able to have an impact on reducing the intensity of economic behavior, either because of restrictions on space for movement or because of a decrease in productivity due to the emergence of new cases and deaths. Although the latest government policy adjustments show some relaxations in the mobility aspect, the government continues to balance this by ensuring strict protocols are still in place, such as the mandatory use of masks. If the individuals and segmentative compliance of each region is collectively optimized, the government believes that the decline in COVID-19 cases will continue to improve significantly. As a closing statement, it must be said that as now, we have been living side by side with COVID-19 for the past 2 years, and we will soon experience significant changes in the policy. Following this, I would like to remind that these changes must not lead us to be complacent, but rather require each individual in the community to be more responsible and vigilant in maintaining their own health protocols discipline. And hopefully, we will be able to learn lessons from all the policy adjustments that have been made so far and continue to try to improve the nation's resiliency in facing emergencies in the future. I will now welcome Minister of Tourism and Creative Economy and Head of the Tourism and Creative Economic Agency. The Minister will explain to us Indonesia's Safe Tourism Program as well as the international travel mechanism. Mr. Minister, the floor is yours.
Thank you very much, Prof. Wiku, and good afternoon, good morning, wherever you are. I have few updates in terms of the policies that has just been announced. Is that the number of foreign visitors have taken a significant drop from the 2019 level to basically in 2021 less than 9.5%. And this has significantly impacted the tourism and creative economy sectors. We believe that these changes to the policy, in particular within Bali, Batam, and Bintan, will be met by enthusiasm by foreign tourists, and it will be successful when we continue to focus on a very strict and disciplined health protocol, and also the integrations of the applications of Peduli Lindungi. We are also receiving early sign of appreciations from foreign tourists that the handling upon arrival have been around 30 minutes of durations. Tourists was also satisfied with the services provided by the hotels and the staffs. And also, there are also room for improvement in terms of how do we handle visas and other facilities of attracting foreign tourists to return to Indonesia. I would like also to update the media and friends from abroad that despite some earlier challenge in terms of the Batam and Bintan scheme, we are now receiving a lot of enthusiasm and requests from Singapore that we will see more tourists will come in to Batam and Bintan. So far in Bali, the warm-up vacation program has been very successfully implemented with low impact of positivity rate below 0.5% based on entry tests between February 2022, and there are close to 1,500 foreign visitors come in, and we are extremely delightful that all ministries and agencies are preparing for a better handling of foreign tourists that will participate in the G20 and many other international events, including the United Nations Disasters Risk Reductions Platform and conference that will take place in May. And we are working together with also stakeholders to prepare for a much better handling of foreign tourist arrival, and treat them with a much better comfort. And we have the certifications called Cleanliness, Health, Safety, and Environmental Sustainabilities that we will be able to offer the foreign tourists safe, comfort, and secure holidays and activities within Indonesia, with more friendly service from airport to hotels to activities and to returning. Tourists can take part of the activities now with a very clear directions on how we continue to be vigilant in terms of applying the health protocol. And we believe that if the general condition is suitable and conducive, we will also see a potential rise of foreign tourists within the upper range of 1.8 to 3.6 million foreign tourist arrival this year. 34 million jobs are within the space of tourism and creative economy, and therefore we will ensure the handling of the pandemic together with Professor Wiku and the rest of the team within the government. We prioritize for the health protocols, but we also would prepare the new economy based on handling the health issues and making sure this recovery would be long-lasting and sustainable and will benefit the people of Indonesia as a whole. Thank you, Prof. Wiku.
Thank you. Thank you. And then I would like to return this to Mbak Egit, if you want to moderate the discussions with the journalists.
Okay, thank you, Pak Sandi, and thank you, Prof. Wiku. We have heard that after passing Omicron peak in February, the case number and mortality rate has much declined. However, Indonesian government believes that the best guarantee of herd immunity is to increase vaccine rates throughout the population, and restriction has been taken as an adaptation towards a safer and more productive society, especially for international travelers who arrive in Bali, in Bintan, and Batam. Also for domestic travelers who no longer need to submit swab results to take public transportation as well. And we also heard that Indonesian government will also improve handling process towards international travelers in our seaports and airports, and we have learned to live side by side with COVID-19 and get ready to see many more changes in the upcoming days. Thank you once again for Prof. Wiku and Pak Sandi for the comprehensive explanation and presentation on COVID-19 updates in Indonesia. And now we will begin our Q&A session, ladies and gentlemen and fellow journalists. Firstly, we will now start with 2 questions that have been submitted earlier. However, if anyone else has questions, please don't hesitate to ask in the chat room, and don't forget to mention your name, your media, your institution, or to whom the question is addressed to. We will start with the first question that goes to Professor Wiku from Chatnews Pasandani from the Australian. The question is, when Indonesia is in the endemic stage, will we go back to pre-pandemic days when we no longer have to wear masks, keep our distance, and so on? Prof. Wiku, the floor is yours to answer.
Okay, thank you. So thank you for the Australian for the questions. So in principle, the controlled condition of COVID-19 cases are influenced by the many factors, and that's including the government policies, the community behavior, and also the dynamic characteristics of the virus circulations in the world over time. And of course, the endemic indicates a condition where the disease is still present now, but now consistent with a consistent number of reducing. And so far, experts agree that the 3M protocols in Indonesia, including mask, is the most effective effort to prevent the transmissions of the COVID-19 virus. But we agree that there is a future, the bright future, that we can go back to the original conditions, as long as we all together in the world, not only Indonesia, that control the disease with the behavior change of us. Thank you.
Okay, thank you, Prof. Wiku, for the answer. The second question is from Asri from KBR or KBR Media. The question is addressed, maybe Prof. Wiku can answer, and also Pak Sandi, welcome to answer too. The question is, how is the supervision and regulation enforcement in the midst of various transportation relaxations? Maybe Pak Sandi can answer first, and then followed by Prof. Wiku.
Thank you.
Yours, Pak Sandi.
Thank you, Mbak Egit. Mbak Astri, I just got back from Pontianak. 2 days visit, and I used the new policies for fully vaccinated travelers, no test required as we board the plane. And I was amazed that the numbers of passengers up by between 30 to 40%. And yet the health protocol is being strictly implemented. I remember a passenger right in front of my row, after he took off his mask and to take his drink, he forgot to put back the mask. Not only the flight attendant, but other people within that row reminded him to put on and put back his mask. So I think the monitoring and enforcement of the discipline of the health protocol must be the task and responsibility for everybody, not only the government, but also the people, private sectors, educational institutions, also the communities and the media, to remind everybody, because we think that we can only be able to continue to handle the pandemic in the most efficient way if everybody is involved. So I'm quite optimistic that this new health protocol regulations and the policies that we are taking, if supported by everybody, including all stakeholders, it will be much easier to monitor and implement it.
Okay, for Prof. Wiku, maybe you can adapt the answer,
Okay.
completing Pak Sandi's explanation.
Okay,
earlier.
thank you. So, Pak Sandi just mentioned about the awareness, the high awareness of people in adapting the situations with COVID-19 and in the air travels. And I think the operators of the transportation itself has been adjusting some of the regulations that they have, but of course they are still strict in terms of health protocols. And I think this is the time that not only the people, but also the regulators in the local areas, the operators are adjusting the policy in terms of people mobility, but at the same time, they are still strict in applying the health protocols. And I think that's the modality of having a more productive economic activity and safe from COVID-19. Thank you.
Okay, thank you, Prof. Wiku. But revenge travel has been a concern to many people, Prof. Wiku and Pak Sandi, as it occurs many times after the ease of travel restrictions. And how do you see this concern towards people in Indonesia as you see revenge travel after the ease of travel restriction has occurred many, many times before?
If I get the questions correctly from Mbak Egit, is how do we make sure that this is well communicated to the people at large? Basically, the government needs to continue to engage communities, the media, and all stakeholders that the pandemic is not yet over. Yes, the government is preparing the transitions, but we are not yet there. We are focusing on continue to decelerate the number of cases, achieving the RT that is required per the world standard. And I think the government cannot do it alone. We have to be united. We have to be together in making sure that travel restrictions, yes, it has been reviewed and we are removing some of the requirements, but we need to continue to remind if the number of cases rise as a result of, let's say, new variants or increase in mobility, then we will have to revisit the policies and make the amendments and adjustments accordingly.
Okay, Pak Sandi, Indonesian government, especially Ministry of Tourism, has established Desa Wisata program. And how do you see this program will continue during this transition towards live side by side with COVID-19? Especially, we have to engage deeper and more intense with people in the villages across Indonesia.
Well, thank you for bringing up the village tourism program. First of all, we need to ensure that this is the year of recovery. 2022 is the year of recovery, and we need to open up more opportunities and create more jobs. We need to ensure the sectors that employ 35 million people across Indonesia will continue its trajectory and its momentum to recover. And village tourism has been the new, well, we use the term new normal, because during the pandemic, actually there's a shift from going to places where is mass and quantity tourism to quality and nature, culture, open space tourism. I call it personalized, customized, localized, and smaller in size. Now, Tourism Village has seen an increase of 30% in 2021 in terms of visitors' arrival. And therefore, we also introduced vaccinations in Tourism Village. We introduced health protocol training as well as enforcing. In the Tourism Village, we installed the QR code for Peduli Lindungi applications, and we ensure the food hygiene as well as cleanliness, health, safety, and environmental sustainability certification is well adopted in the Tourism Village. So we believe that this is a pandemic winner, and if we are able to work together, the Tourism Village will form as a new economy that will be the locomotive for us to create more opportunities and return the number of jobs that we have lost during the pandemic.
And for Prof. Wiku, maybe you can add up about what will national task force do to work side by side with Minister of Tourism in order to do a personalized approach that will be applied to promote tourism village, as Pak Sandi mentioned earlier.
Okay, thank you, Mbak Egit. So it has been mentioned by Pak Sandi Uno that with the village tourism is part of the programs, and with the relaxations of the people mobility in Indonesia, at least for the international travelers, for the tourism, that they can come to Indonesia without any quarantine into 3 entry points, which is Bali, Batam, and Bintan. But then after they entered into Indonesia in this safe entrance gate, then they can continue to travel to other areas in Indonesia, which is very beautiful, and there are many tourist areas that are managed well. And I think this is also part of the recovery year, that of course the other part of Indonesia will be exposed to the international travelers and tourism. And as the task force, COVID-19 task force, we want to make sure that health protocols are strictly applied to all of the economic activities, including tourism. And we will adjust the regulations to make sure that people can have more productive activities, and we will prevent the increase of cases in Indonesia. And of course, the monitoring of the national cases, including local area cases, we always monitor every day, every week, and we will adjust the policy when necessary. If it's not, then we will relaxing more, and we can live side by side with COVID-19.
Okay, thank you, Prof. Wiku. And going back to COVID-19 updates in general, how do you see the general evaluation related to implementation of the travel bubble that has been implemented in Indonesia, especially in Batam, Bintan, and during MotoGP in Mandalika and G20 and in Bali?
For me, I think we are very optimistic, Prof. Wiku and member of the media, that these new policies with so-called removing some of the requirements for quarantine, as well as the improvement in visa applications by reintroducing visa on arrival would be very positive. And if we look at this Batam, Bintan, Singapore, and MotoGP, as well as G20 and UN Disasters Risk Reductions Platform Conference, we believe that events will lead our recovery. So with more events, more activities, and the economies will benefit, which at the end of the day will create jobs and increase the income of the people within the areas that have been 2 years suffering from this pandemic. So we have been able to obtain very good feedback from the industry, and we are very, very, I would say, enthusiastically, although still cautiously optimistic that the MotoGP next week and many other events, international events, including World Tourism Day that will take place in Indonesia, will be able to be done on a smooth, safe, and also within the health protocol corridors in order for us to make sure that there won't be any risk that we impose to foreign tourists who would be participating in all of these international events. Baik.
Thank you, Pak Sandi, for such optimistic and uplifting explanation. We are so ready to welcome the new post-pandemic phase in Indonesia. How about you, Prof. Wiku? Maybe you have some closing statements to wrap today's press conference according to safe tourism explanations brought by Pak Sandi.
Okay, thank you. So this press conference, of course, it's very important for the government of Indonesia to convey the messages to the public, general public, not only Indonesia, but also internationally, that Indonesia now is moving to a more relaxed policy in terms of COVID-19, although we are very cautious in the development of the cases all across the world. And we always compare the policy and the situations to other countries, including neighboring countries. And we see that in this year, this is a great opportunity to recover together. And with the G20 activities since the end of last year up to this year, there are hundreds of activities, and we want to make sure that this activity is safe and the messages will be conveyed to other countries in the world that Indonesia is becoming safer and safer, and of course other country as well, and we can over with the pandemic of COVID-19. Thank you.
Okay, Pak Sandi, now it's time for you, so please to share closing statement from you as the Minister of Tourism in Indonesia.
Thank you, Mbak.
Thank
you, Mbak Egid, and thank you, Prof. Wiku and team here at the COVID-19 task force. We are very, very optimistic that the new regulations and policies will enable us to bring forward the recovery and accelerate the recovery program. As you know, we have been handling this health aspect of this pandemic, alhamdulillah, very, very so far under control. But it is time for us to transition in the new phase of the handling of the pandemic, which is making sure that the economic side of the people in general that has been affected will also be prepared to recover. We call this a new economy. What is a new economy? It's basically an economy that is very strict in the adherence of health protocol. The new economy will be more digitalized, and the new economy will basically introduce sustainability and health aspects, as well as making sure that we create more opportunities for business and more jobs for the people of Indonesia. So thank you very much, and I look forward to come here again and give an update for the international media. Definitely towards the middle of this year, as we go deeper into preparations of G20 and the preparations for other super priority destinations. Thank you, Prof. Wiku, and thank you, Mbak Egid.
Thank you, Prof. Wiku, and thank you, Pak Sandi, for such an optimistic explanation before. And now, ladies and gentlemen, fellow journalists, we have come to the end of today's press conference. Thank you once again for Prof. Wiku and Pak Sandi for delivering COVID-19 updates, and thank you for our fellow journalists for your attendance virtually. Stay safe and stay healthy.
Thank you.
Thank you.
Pandemi hanya akan pergi bila kita saling peduli. Sebab bila tidak, gelombang baru datang dan pergi. Berani mengingatkan orang lain untuk lindungi diri, saling jaga, mau menerima dan rela memberi. Kencangkan lagi maskermu. Kurangi mobilitas dan hanya untuk yang perlu. Rutin olahraga dan vaksinasi lengkap demi imunitasmu. Kita percaya kita pasti bisa.